Hello, my name is Felicity. Welcome to my presentation on Dialectical Behavior Therapy. DBT teaches skills on how to move forward and effectively deal with problems that people encounter in their lives. I often find myself self-reflecting and end up frustrated. I find out what the issue is and how it came about, but do not necessarily know what to do next. Learning DBT aided me in not only teaching me how to handle all sorts of challenges, but also guided me through the execution. Now it's time to explain what DBT is. DBT stands for Dialectical Behavior Therapy. Dialectical is the art of investigating or discussing the truth of opinions and the inquiry into metaphysical contradictions and their solutions. Behavior is the way in which one acts. DBT stands for Dialectical Behavior Therapy. Dialectical is the art of investigating or discussing the truth of opinions and the inquiry into metaphysical contradictions and their solutions. Behavior is the way in which one acts and conducts oneself, especially toward others. And therapy is the treatment intended to heal or relieve a disorder. DBT consists of the following skills: mindfulness, interpersonal effectiveness, emotion regulation, and distress tolerance. The first DBT study focused on the treatment of highly suicidal adults. Now we have research demonstrating the efficiency of DBT skills training with suicidal adolescents, as well as adults with borderline personality disorder, eating disorders, treatment-resistant depression, substance use, and a variety of other disorders. A diagnosis of a mental disorder is not required, however, to benefit from DBT skills. Dr. Esme Schaller is a clinical psychologist who heads the Dialectical Behavior Therapy program at the Young Adult and Family Center in UCSF. According to her, the main goal of DBT is to build a life worth living. DBT is not meant to be a suicide prevention program. It's meant to help you. DBT is one way to overcome suicidal feelings. In DBT, therapists work with you to establish target behaviors. Those who benefit the most are those who have a difficulty in regulating emotions. DBT is a structured individual therapy which tracks emotions and actions. It consists of a skills group, which is an interpersonal relationship study. Here is a link and a picture of the book that holds all the DBT skills, handouts, and worksheets by Marsha M. Linehan. She, quotes, developed many of the skills by reading treatment manuals and treatment literature on evidence-based behavioral interventions. I reviewed what therapists told their patients to do and then repackaged those instructions in skills handouts and worksheets and wrote teaching notes for therapists. End quote. I interviewed Mr. Nugent, a licensed clinical psychologist. He first started learning DBT 3 to 4 years ago in school. Now he has 2 years of experience with teaching dialectical behavior therapy to his patients. He first started off with CBT, which is cognitive behavior therapy. He liked how DBT is built off of CBT and how it incorporates how emotions are connected to thoughts and behavior. What drew him to DBT was how inspiring Marsha Linehan's research was, and how effective it was too. He recommends DBT to those who have depression, mood problems, anxiety, and drug addictions. The first skill I'm going to cover is mindfulness. Mindfulness consists of wise mind, what skills, and how skills. Wise mind is my favorite. It expands your awareness by utilizing reasonable mind or rational mind, and your emotional mind to create wise mind. Wise mind is the wisdom within each person. It sees the value of both reason and emotion. It brings the left brain and the right brain together and creates a middle path. Your what skills are observing, describing, and participating. It's important to notice your body sensations, to pay attention on purpose to the present moment, to practice wordless watching, and to observe both inside and outside yourself. It's important to put words on the experience, label what you observe, and unglue your interpretations and opinions from the facts. Describe the who, what, when, and where that you observe, just the facts. Then, participate. You throw yourself completely into the activities of the current moment. Do not separate yourself from what's going on in that moment. Become one with whatever you're doing, and act intuitively from wise mind. Lastly are the how skills. This is the non-judgmentally, one mindfully and effectively. It's important to see but don't evaluate as good or bad, to accept each moment like a blanket spread out on the lawn, and acknowledge the difference between the helpful and harmful, the safe and dangerous, but don't judge them. Also, acknowledge your values, wishes, and emotional reactions, and do not judge them. When you find yourself judging, do not judge your judging. You can more mindfully rivet yourself to the now. Do one thing at a time and let go of your distractions. It's good to be effectively mindful of your goals in a situation, to focus on what works, play by the rules, and act as skillfully as you can. Mindfulness includes modules and handouts and guide you through these worksheets on the situations that you can encounter and the situations that you have encountered. The next skill I'm going to cover is interpersonal effectiveness. Interpersonal effectiveness consists of clarifying priorities, factors to consider, dear man, give, and fast. The goals of interpersonal effectiveness is to be skillful in getting what you want and need from others, to build relationships and end destructive ones, and walk the middle path, also known as wise mind. Some of the factors in the way of interpersonal effectiveness is you don't know what you want, your emotions are getting in the way, you can forget your long-term goals for short-term goals, other people are getting in the way, or your thoughts and beliefs are getting in the way. Now, these skills that interpersonal effectiveness teaches you helps you work through and overcome those factors that get in the way. It's important to clarify your priorities. You need to address and establish what you want and how you can obtain your goal. Keeping your relationship with with another person and yourself, and maintaining your self-respect. Some factors to consider is deciding on how firm or intense you want to be and asking for someone, or when you need to say no. Dear Man is the guideline for objectives effectiveness, also known as getting what you want. The acronym Dear Man consists of 7 words, which are describe, express, assert, reinforce, stay mindful, appear confident, and negotiate. Feel free to pause the video and read the handout on this slide further. Give is the guideline for relationship effectiveness, or keeping the relationship. The acronym GIVE is made up of 4 words. Be gentle, act interested, validate, and use an easy manner. Feel free to pause this video and read up more on GIVE. Lastly, there's FAST, which is a guideline for self-respect effectiveness, or keeping respect for yourself. The acronym consists of 4 words: be fair, no apologies, stick to values, and be truthful. Feel free to pause this video to read further on FAST. The next skill I'm going to talk about is emotion regulation. Emotion regulation consists of what makes it hard to regulate your emotions, what emotions do for you, and a model for describing emotions. Some of the things that make it hard to regulate your emotions are biology. These biological factors can make emotion regulation harder. A lack of skill. You don't know what to do to regulate your emotions. Reinforcement of emotional behavior. Your environment reinforces you when you are highly emotional. Moodiness. Your current mood controls what you do instead of your wise mind, and you don't really want to put in the time and effort to regulate your emotions. Emotional overload. High emotional arousal causes you to reach a skill's breakdown point. You can't follow skill's instructions or figure out what to do. And lastly, emotion myths. Myths, for example, mistaken beliefs about emotions, get in the way of your ability to regulate those emotions. Myths that emotions are bad or weak lead to avoiding emotions, and myths that extreme emotions are necessary or part of who you are keep you from trying to regulate your emotions. What emotions do for you? Emotions motivate and organize us for action. Emotions communicate to and influence others. Emotions communicate to ourselves. Please pause the video to read more on what emotions do for you. The book offers ways to describe emotions, prompts, interpretation, biological changes and experiences, expressions and actions, and after effects of said emotions. Some emotions are anger, disgust, envy, fear, happiness, jealousy, love, sadness, shame, and guilt. Please pause the video and follow the flowchart. The last skill of DBT is distress tolerance. Distress tolerance consists of the pros and cons, self-soothe with the 5 senses, the stop skill, tip your body chemistry, distract with wise mind accepts. So distress tolerances are crisis survival skills. You are in a crisis when the situation is highly stressful, short term, that is, it won't last a long time, creates intense pressure to resolve the crisis now. You can use this crisis survival skills when you have intense pain that cannot be helped quickly. You want to act on your emotions, but it will only make things worse. Emotion mind threatens to overwhelm you and you need to stay skillful. You are overwhelmed, yet demands must be met. Arousal is extreme, but problems cannot be solved immediately. Do not use crisis survival skills for everyday problems, solving all your life problems, and making your life worth living. Here we have the STOP skill. STOP is an acronym for stop, take a step back, observe, and proceed mindfully. Use pros and cons anytime you have to decide between 2 courses of action. Before an overwhelming crisis urge hits, write out your pros and cons and carry them with you. Rehearse your pros and cons over and over. When an overwhelming crisis urge hits, review your pros and cons, get out your list and read it over again. Imagine the positive consequences of resisting. Think of the negative consequences of giving into the crisis behaviors. Remember past consequences when you have acted on crisis urges. Here we have the acronym TIP, changing your body chemistry. Tip at the temperature of your face with cold water. Intense exercise to calm your body down when it is revved up by emotion. Paced breathing. Pace your breathing by slowing it down. And paired muscle reaction. To calm down by pairing muscle reaction with breathing out. You can distract yourself with the phrase wise mind accepts. Activities, contributing, comparisons, different emotions, pushing away, other thoughts, and other sensations. A way to remember these skills is to think of soothing each of your 5 senses with vision, hearing, smell, taste, and touch. To summarize, DBT is used to treat several different issues such as depression, mood problems, anxiety, addictions, etc. DBT teaches skills on how to deal with issues. And this form of therapy and problem solving suits my needs for self-actualization. Here is a quick reference list for the dialectical behavior therapy skills. Thank you for watching my presentation.